Are you one of the many women out there who want a non-hormonal form of birth control but aren't super excited about the copper IUD? I mean, sure, there are condoms, but many women and men don't really love using them for various reasons, and diaphragms still exist, but they can be cumbersome and you have to use them with the spermicide. Well, let me introduce you to Phexxi. As a certified nurse midwife who counsels women almost daily on birth control options, I have found that many women don't know Phexxi actually exists. In fact, a lot of healthcare providers don't know it exists either. In this video, we'll explore what Phexxi is, how it's used, how it works, its possible side effects, and how effective it is compared to other birth control methods. Then we'll go over some real-life examples of when I counsel women that Phexxi might be right for them. By the end of this video, I hope that you can decide whether Phexxi may or may not be right for you. So what is Phexxi? Phexxi is a non-hormonal vaginal gel. I've got some examples here that the company sent me. So it comes in this nifty little package. It's a 1 applicator per package insert, and the box, I believe, comes with 12 of these. Inside, you've got an applicator that kind of looks like a tampon applicator. It's got a little cap on, and it's got a plunge that helps to push the gel out. This one actually has gel in it, so you can kind of see what the gel looks like. And it's pretty thick. It looks a little globby, if you can see that. But yeah, it kind of fills up the whole container, and that's what you place inside your vagina. Now, you want to insert the applicator and the gel inside the vagina up to 1 hour before an active intercourse. And each applicator is only good for 1 act of intercourse. Now, what does an active intercourse actually mean? What they're saying is it's only good for 1 ejaculation, and the gel is only good for 1 hour. So what I tell people is, if you're having a day of sexcapades where there might be multiple ejaculations, you need to add 1 applicator of gel inside the vagina for every ejaculation, and make sure to replenish it every hour. Crystal clear? If not, make sure to leave a comment below and I'll help to clarify things. And hey, if you have any other thoughts on the subject, make sure to leave those in the comments as well. Let's talk about how Phexxi works. Have you ever heard of spermicide? If you have, get it out of your head. Phexxi is not a spermicide. It is a vaginal gel that reduces the motility of the sperm. While spermicide kills sperm and needs to be used along something else like a diaphragm or a cervical cap, Phexxi immobilizes sperm and can be used as birth control in and of itself. It immobilizes sperm by maintaining a vaginal pH that keeps the sperm from entering the cervix, going through the uterus, going through the fallopian tubes, and meeting up with those eggs to make babies. If you are not wanting to make babies, you need to keep those spermies from getting to the right place. Gotta keep those swimmers from swimming. Because Phexxi is a vaginal gel and can impact vaginal pH, there can be a few side effects. Now, hear me when I say every birth control has side effects. And so I'm going to tell you about the ones with Phexxi because I'm here to educate you and not to sugarcoat the facts, but you need to decide which side effects you're okay with and which ones you're not. With Phexxi, the main side effects can be vaginal or penile discomfort for women or men, and also for women, it can increase the risk of vaginal infections or UTI. The upside is that Phexxi is non-hormonal, so you're not getting all those side effects that come along with the hormonal type of birth control. However, it's not completely side effect free for some women. One of the things I'm very clear about with my patients is how effective Phexxi is. For real-world use, the efficacy of Phexxi is about the same as condoms. It's upper 80th percentile. But for perfect use, condoms actually protect against pregnancy in the upper 90th percentile, whereas Phexxi only protects against pregnancy in the lower 90th percentile. Most other forms of birth control, the hormonal birth control and the copper IUD, are 98 to 99% effective with perfect use. So Phexxi is a little bit less effective than other birth control methods when studied. Because of this, I only recommend Phexxi for certain patient populations. If you are a woman who is 200% certain that you do not want any babies or any more babies, then Phexxi in and of itself may not be the right method for you. But here are some examples of patients I have recommended Phexxi for. And most of them, I am recommending Phexxi alongside another method. I once had a patient tell me her husband had a vasectomy, but she was too nervous to trust it. Now, quick side note, if a partner had a vasectomy and he has not gone back to get tested for sterility, then you can't be certain that he's actually sterile. But in this woman's case, he had been tested again. She was just feeling nervous. She wasn't really excited about a hormone option of birth control, and so I introduced her to Phexxi. She was so excited about the option of an on-demand birth control that didn't impact her hormones. All she wanted was a little extra reassurance, and Phexxi was going to give it to her. I once had a patient who was 6 weeks postpartum, and she was ready to start having intercourse with her partner again. Unfortunately, she was very conflicted about what kind of contraception she wanted to use, but she'd had a really tough postpartum course, and she was certain she did not want to get pregnant again right away, if ever. I'm going to say something that I've said in a lot of other videos. Ladies, do not rely on breastfeeding as a form of contraception. You never know when you're going to ovulate. It may be, 6 months to a year later, or it could be right away. And there's no way to predict when you're going to ovulate. But what is certain is that you will ovulate before having your first period. So you can't just wait to start birth control until you have your first period. So this woman knew she wanted to be sexually active, she knew she wanted birth control, and she thought, I guess I'm just going to do the copper IUD because I've had a horrible experience with other birth control methods, and I want something that's non-hormonal. And when she got to my office, she was really scared of getting an IUD inserted. And so we talked about Phexxi. We talked about it as just using it alongside breastfeeding as a form of contraception in general, and we talked about it as a bridge method until she was ready to get her IUD placed. Either way, she was thrilled to have an option that meant she didn't have to have a painful procedure, but she could be pretty darn certain she wasn't going to get pregnant right away after having a baby. And quick side note, for women who are breastfeeding, typically vaginal lubrication is a little lower than when you're not breastfeeding. And so when Phexxi comes as a gel, it adds a little extra lubrication, so it's kind of a win-win. Speaking of IUDs, I had a patient once whose IUD was expiring and she needed it removed and replaced. However, she'd had a pretty bad experience with the first insertion of her first IUD, and she wasn't quite ready to bite the bullet to go through the procedure again. But once her IUD was in place, she loved it, so she knew she wanted to get another one. So we talked about doing Phexxi while she waited to be ready to get another IUD placed. The reality of IUDs is, they do expire. However, the IUD doesn't know when it actually was placed, and so it's probably got a little bit of time after we know it's technically expired that it's still effective. But for a little bit of extra reassurance before she was ready to get her IUD placed, she used Phexxi, and she was super happy with the results. Okay, raise your hand if you are one of the many women out there using the pull-out method as a form of birth control. And now, raise your hand if you think it's been a super effective method and you're going to continue using it and it really works well for you. And now, raise your hand if you are one of the many, many women who've gotten accidentally pregnant using the pull-out method. And then, if you're one of those women, put that in the comments so that other women out there can see that it's not necessarily the most reliable method. If you're one of the many women out there using the pull-out method for birth control and you are highly against getting pregnant, I would really recommend using a different form of birth control or a combo birth control like Phexxi and the pull-out method. If you want to get Phexxi, you do need a prescription. You'll need to talk to your healthcare provider, but if you don't have one of those readily available, you can actually go to Phexxi's website and you can get hooked up with a healthcare provider who can prescribe it for you, and you will get it shipped to your door. I'll put the link to the website in the video description. If you're like many of the women that have come into my office wanting a birth control method that's both non-hormonal, not a copper IUD, and not a barrier method, then I encourage you to think about Phexxi. And if you want to learn about all the other forms of birth control, I have lots of those videos on my channel. In fact, you can check out this video about IUDs. Thanks for watching. Stay safe, stay healthy, and don't get pregnant. Unless you want to.